Hello, good afternoon. We were supposed to have this conversation in the morning, but my day was a very difficult one. But uh, Nonetheless, we are here until our conversation and tag somebody, invite somebody, and if they are not here and you think that they will find this conversation useful, share it and tag them. So do tell us where you're watching us from. As usual, we're interested to know where you could be watching us from. So go ahead and tell us where you are seeing us from. We are also interested to know where you're watching us from. Now, so this morning we were supposed to have discussed the issue of alcoholic liver disease, but we were unable because of time constraints. But here we are. So, very quickly, I will take about 10 to 11 minutes of your time to go through this conversation so that you are aware. Now, alcoholic liver disease is very, very common. And if you look at the race distribution, Black people, Hispanics are more vulnerable to alcoholic liver disease. As I go through the risks of alcoholic liver disease, you will see that race plays a role, and being Black is one of those factors that makes you vulnerable to alcoholic liver disease. Now, the issue is, what is alcoholic liver disease? So, alcoholic liver disease is a spectrum of diseases that are caused by excessive consumption of alcohol. So, you're talking about consistent excessive consumption of alcohol. However, there are some types of alcoholic liver disease that attack people who are vulnerable, even if they have not been drinking alcohol for a very long time. So when I'm done with this conversation, or when we are done discussing this, you will become very clear on what exactly we are discussing. So now, people usually ask, so Doc, what is excessive drinking? So somebody who is engaged in excessive drinking, these are people who either drink every day. If it's beer, take somebody who takes at least a six pack every day, minimum. That's considered excessive drinking. Or somebody who engages in binge drinking, which we think is what most of you do over the weekend, where you drink a lot in one sitting and you get sloshed or you get drunk, beregede, over the weekend. That's binge drinking, where you really, really drink and you really, really get drunk. Even if you do it once in a while, binge drinking has its issues. As we go down in this conversation, you will see why binge drinking is also an issue. And also, the way you drink matters. So, when we tell you to drink responsibly, that's basically what we mean, that you need to understand what you're drinking, you need to understand what beer is for, you need to understand and how to drink, but also on top of that, you need to understand your own body. Now, when you talk about alcoholic liver disease, it's graduated in severity. So, in the early stages of alcoholic liver disease, people get what we call a fatty liver. Now, a fatty liver happens because somebody has been drinking excessively for a very long time and they develop a fatty liver. However, a fatty liver can happen even when you have not been drinking alcohol for too long. However, the other issue about the advantage you have with a fatty liver is that if it's detected early, it can be reversed. Now, what is fatty liver? Fatty liver, this is where the cells or your liver itself gets packed with fat or fat cells, such that the liver cells themselves begin to disappear. And the functionality of the liver also begins to get compromised. Why? Because fat is accumulating in your liver. Now, the challenge you have with fatty liver is that, generally speaking, it has no symptoms. So most people walk around with fat in their livers and they don't even know. That is why if you take alcohol, make it a point from time to time to take a break or give yourself an alcohol holiday, or at the very least, if you know you take too much alcohol, get yourself screened. Go see your doctor, let them do an ultrasound or scan your liver, and then they'll be able to tell you whether you know you have too much fat or not. Now, fatty liver, generally speaking, doesn't have symptoms, but sometimes you will find that people may experience general body weakness, general body malaise, poor appetite, and usually you'll find that people who end up with alcoholic liver disease also have malnutrition, because most people who have these problems usually end up, drinking too much alcohol without even eating, or they don't eat well or forget to eat, and they end up with malnutrition. And because of that, they also end up with other symptoms. So they may experience diarrhea from time to time, may experience general body, general abdominal discomfort. However, these are not specific to fatty liver, because generally speaking, fatty liver has no symptoms. So someone may be walking around, they have a fatty liver, and and they don't know. Now, if fatty liver has no symptoms, then what's the issue there? The issue there is that if somebody does not stop drinking or does not give themselves an alcohol holiday, that fatty liver can degenerate into either fibrosis or into cirrhosis. Now, those issues are words I'm using, like fibrosis, cirrhosis of the liver. Those are permanent damage to the liver, and those are not reversible. However, the issue is that with fatty liver, it is reversible. So what do you do as a doctor? You find your patient, they take alcohol in excess, and they've developed fatty liver. The treatment for fatty liver is to stop taking alcohol. So you tell somebody you need to go on an alcohol holiday, they have to stop taking alcohol, minimum 2 weeks, maximum 6 weeks, and after that, if you check, you find that the fatty liver will have reversed, and they will no longer have, the fat in their liver, and they can go back to drinking if they so wish. But again, they need to pay attention. Another problem that alcohol causes on the liver is called alcoholic hepatitis. Now, alcoholic hepatitis is a lot more serious than fatty liver. Now, alcoholic hepatitis can be seen also in people who drink excessively for a very long time, but that is not a requirement for alcoholic hepatitis to happen. It can also happen to people who drink occasionally, or people who just drink over the weekend and they binge drink. Now, if you binge drink, you may be vulnerable to alcoholic hepatitis. And usually, alcoholic hepatitis has symptoms. It's a serious disease of the liver, and people present with yellowing of eyes, abdominal pain, nausea, vomiting, and if it is not handled properly, they may also complain or may also present with confusion, which can even lead sometimes to serious complications. So if alcoholic hepatitis is not properly handled or properly treated, this particular condition is treated in a hospital setting. Of course, we stop the patients from taking alcohol, and they are given, supportive treatment until the liver recovers. Now, generally speaking, develop these kinds of problems, you'll find that in their family, there's somebody who may have developed alcoholic hepatitis, or these are people who've been drinking for a long time and drinking excessively. And usually people have this problem, you'll find that they'll be drinking and they're not also eating. That's why people advise you that when you're having alcohol, do not have alcohol between meals. Or if you must, then you might be eating while you're drinking alcohol. Have some food of some kind, okay? Because the challenge you have is that if you're not, eating while you're drinking, you're also vulnerable to this. However, the thing is that some of you are genetically predisposed to alcoholic liver disease, and you are not even aware that it runs in your family. So if there's somebody in your family who suffered alcoholic liver disease, you may also suffer the same. Now, when these things are not looked after properly and you are treated, you recover, but you continue taking alcohol, then permanent damage does happen to the liver. When the liver suffers permanent damage, there is what we call cirrhosis or fibrosis. This is where the cells of the liver have died and they have been replaced with scars. So the same scar you see on your skin can also happen in the liver, where cells have died and there's scarring. Now, that scarring, which we call fibrosis or which we call cirrhosis, can also be very extensive. You have scars all over the liver, or the entire liver may be scarred. Now, depending on the extent to which the alcohol has scarred your liver, if we find that the scarring is not very extensive, okay, what your doctors might do, they may advise you to stop alcohol altogether because the liver is able to grow back. But if the scarring is extensive, you've reached cirrhosis of the liver and the liver is completely damaged, you end up with what we call chronic liver disease, and the only treatment of choice there is liver transplant. And you know that in Zambia, there is no liver transplant. So now, what are the risks of alcoholic liver disease? Who is more likely to have alcoholic liver disease? The people who are vulnerable to alcoholic liver disease, number one, it is people who drink excessively and drink every day. So excessively, we mean minimum of a six-pack. So if you drink a six-pack every day, that's considered excessive drinking. And secondly, people who binge drink. Yes, you drink over the weekend, but again, you drink in excess over the weekend and you get really, really drunk, then you're susceptible to alcoholic liver disease. If you are female, females need to pay attention to how much alcohol they take because naturally you have more fat than men. So you are more vulnerable to alcoholic liver disease, and also your hormones, you are more vulnerable to alcoholic liver disease. So if you're a female, pay attention to how much you drink because you are more susceptible to alcoholic liver disease than your male counterparts. So just bear that in mind. If you are obese or overweight, so people who are obese and overweight need to pay attention to how much alcohol they take if they should choose to take to the bottle, because they very quickly develop alcoholic liver disease, very, very quickly. The other issue is that if you are a black person, compared to other races, you are more likely to develop alcoholic liver disease. The other issue is some of these things run in families. Alcoholism itself runs in families. Why? Because alcoholism is also genetic. There are some people among us who can't help it, but drink alcohol excessively because they have a genetic vulnerability to alcoholism. So you find that maybe his grandmother was an alcoholic, his father was an alcoholic, his uncle was an alcoholic, and he's also an alcoholic, not because of association or behavior or modeling, but purely because this person inherited a gene for alcoholism. All right. So just bear that in mind. The other issue is that when people have, say, hepatitis C infection and they continue to take alcohol, they are also very vulnerable to alcoholic disease. And people who have other diseases, like diseases where your body does not handle iron properly, and you end up with iron in your body and you don't even know it, and then you continue taking alcohol in excess, you are easily going to be vulnerable to alcoholic liver disease. So now, what's my take-home message here? If you must drink alcohol, drink responsibly. Understand your body, understand your volumes. The other issue is that do not drink alcohol on an empty stomach, like some of you like doing, where you go drinking and you forget to eat. Don't drink alcohol in between meals, because if you drink alcohol in between meals and you have not even eaten, you are just making yourself, opening yourself up to alcoholic liver disease. Alcohol is meant to be enjoyed. It's not supposed to destroy you. And alcohol is supposed to be enjoyed. It's not supposed to enjoy you. All right? And so exercise greater self-control for you to be able to enjoy alcohol longer and in a healthy way. Otherwise, if you see that alcohol has started giving you problems, just stop altogether. Just stop. Ladies and gentlemen, this has been Dr. Mjajati conscientizing you on alcoholic liver disease and how you prevent it and probably even pay attention to some of these things. And do the usual, the way we always ask you to. Share this video because we need this information to spread as much as possible. We need people to be wary and aware of these problems. Usually what I do, or what most doctors do, is that when we're doing routine medicals for people and we find that you drink excessive alcohol, we will actually suggest that you do an ultrasound so that we see whether what your liver is doing. Even you yourself, just make it a point. If you know that you drink a lot of alcohol, from time to time, just go and get a scan of your liver. It gives you more information. It makes you make more informed choices. Yeah. So that's it for healthy and prosperous citizens. This has been Dr. Mjajati discussing a very specific issue relating to alcoholic liver disease. And for the rest of you, please do share this video. We need this information to go out as much as possible. So click that share button. And then if you have missed this video, you know somebody who may have missed it, you'll find this video on our YouTube channel. So subscribe to our YouTube channel as well for ease of navigation should you miss this content. Do take care. We'll chat tomorrow again with another topic.